Hello everyone, I'm Celebi. I'm a PhD student at Istanbul Bahçeşehir University's Architecture and Design PhD program. This study will be presented as part of my PhD thesis. The title of the study is Examining the Spontaneous Spatial Transformation of ICUs During the COVID-19 Pandemic, a study on the dynamics of nurse-patient interaction for future pandemic preparedness. Let's briefly remember the pandemic period. The pandemic caused by the novel coronavirus during late December of 2019 has quickly expanded from China to other regions. World Health Organization has declared the coronavirus disease a global pandemic due to its rapid human-to-human transmission and its intensity of critical acute respiratory symptoms. In this period, when the pandemic-induced economic crisis is trying to be overcome, the preparations performed in the field of health for future pandemics continue to be discussed. When the challenges experienced during the pandemic are evaluated, it is seen that an effective healthcare system preparedness is required. Before addressing the main role of the healthcare system and the importance of healthcare facilities, firstly, the global impacts are compiled comprehensively in order to have a better understanding. The damaging effects of COVID-19 has been felt, especially the economic area on a global scale. All economic activities in many countries has been halted. Along with difficulties in the economic area, the pandemic also has affected the society psychosocially. Billions around the world suddenly became prisoners in their own home. COVID-19 not only compounded deep underlying problems of health policy, but also revealed the inability of mobilization of health system in terms of diagnosis, treatment, and prevention. More essential supplies and healthcare resources in demand to healthcare services undermined the finances of significant number of hospitals. Also, healthcare staff had to face many challenges in their operational management while maintaining essential services. For a strong and resilient healthcare system, the importance of pandemic response plan has been revealed with this experiential process. World Health Organization describes the pandemic response plan, the arrangement's role, responsibilities, and activities required to enable the hospital to function adequately in an emergency. In effective healthcare system preparedness for all type hospitals, including the adaptation of healthcare facilities to pandemic conditions, determination of treatment locations in each health region, management of healthcare professionals and training of them, and lastly, the organization of medical equipment according to pandemic requirements. In the context of planning strategies of healthcare system in Turkey, the declared pandemic hospitals is compiled through public, city, and private hospitals. The processes include the transformation of existing hospitals, non-sanitary building, makeshift hospitals, and prefabricated COVID-19 quarantine hospitals. The transformation of the TÜYAP Exhibition Center in Adana into 1,000-bed field hospital can be given an example of makeshift hospitals. Also, prefabricated COVID-19 quarantine hospital has been established at the existing large venues such as on the Atatürk Airport runway on the European side of Istanbul. The transformation of existing hospitals was carried out in different ways. For example, the historical Hadımköy Military Hospital has been repurposed and restored as a 100-bed pandemic hospital with ICU, polyclinics, and emergency services. The hospitals which have at least 2 of the infectious disease and clinical microbiology, chest disease, and internal medicine specialists, and third-level adult ICUs, 1 operating room and 1 delivery room for infected pregnant women has been considered pandemic hospitals. Surge capacity is defined as the ability of a health service to expand beyond normal capacity to meet increased demand for clinical care. The Joint Commission on Accreditation of Healthcare Organization states that surge capacity encompasses potential patient beds, available space which patient may be triaged, managed, vaccinated, decontaminated, or simply located, available personnel of all types, necessary medications, supplies and equipment, and even the legal capacity to deliver healthcare under situations which exceed authorized capacity. According to World Health Organization, surge capacity includes four basic interrelated planning: staff, space, supplies, and putting them into the context with system and procedures. The planning of them created a comprehensive approach to manage surge capacity. Therefore, an efficient response plan depends on the accurate functioning of all these intertwined components.
Very sick and cannot get any oxygen to the blood, and then in order to keep the patient alive, you have to get blood out of the body and oxygenate out of the body.
The patient's oxygenated blood is pumped back into his body.
Everything about being here is just really intense. The machines are constantly going off, wearing this protective gear, and I have to say, these nurses, these doctors, they really have nerves of steel.
The staff is surprisingly upbeat. The hospital is not overwhelmed despite daily jumps in positive cases in the thousands countrywide.
And this area is another intensive care unit. Now it's free, as you've seen. We have plenty of spaces.
Unlike in some areas of the US or Europe, there is no shortage in PPE, bed space, or life-saving medical equipment. Around 70 of the staff have tested positive for COVID-19. Bushanur Chakmak, an emergency room nurse, was among them. This is her first day back on the job. To be honest, I can't say that I'm not afraid. It's stressful, she tells us. But I am more cautious now than I was before. No matter how hard the staff here work, no matter how ready they are for an influx they hope will never happen, they can't beat this pandemic on their own. That.
As you watched from the video, ICUs are so important to cope with such COVID-19 pandemics. They are special medical areas with specially trained healthcare staff dedicated to the monitoring and treatment of patients with life-threatening disease, injuries, and complications. The most important component of transformation to meet patient surge is the preparation of ICUs in terms of bed capacity, ICU staff, medical equipment, triage procedures, and infrastructure. Many challenges were experienced during the implementation of all these organizations of components during the pandemic. Once the challenges were identified, strategic actions were quickly taken. For example, special challenges due to the increase in bed capacity were special constraints, shortage of single units, the placement of more medical equipment, and the implementations were adding new beds to existing ICUs, transforming certain units with sufficient infrastructure to patient room, shared units for confirmed cases, and the remote monitoring of patients. COVID-19 pandemic should lead to transformative change in how we provide critical care. This includes improved ICU bed capacity and design, flexible ICU staffing, reliable supply chains for PPE, ICU devices, consumables, and pharmaceuticals, establishment of ICU triage principles, improved communication with families, digital transformation, and more agile collaborative research. What is the motivation behind this research? In terms of preparation for future pandemics, the lessons occurred in COVID-19 could be a milestone in the evolution of ICUs, because ICUs faced with many challenges such as increasing bed capacity and ensuring effective infection control. And there is a reality of that future pandemics will force ICU healthcare services. It's imperative to make ICU space more adaptable for emergencies. Before determining the subject of the study, it is important to understand the pandemic from a general perspective and evaluate decision mechanisms at different scales. The procedures and action plans published by World Health Organization on a global scale and the published by the Turkey Ministry of Health and Pandemic Committee on a Turkish scale come to the fore. At the hospital scale, which is the starting point of this study, Spatial interventions performed quickly by healthcare staff. To determine spatial interventions, pandemic hospitals subject to high surge were selected, and then in the designated hospitals, the third-level reanimation ICUs where critical COVID-19 patients hospitalized were examined. In the study, in order to understand the complex structure of the ICU, the space is first considered as a wall, and then the subject is narrowed down and the focus is direct to the patient bed space where direct communication with the patient occurs. While showing the scope of the study, the factors affecting ICUs, especially the unit of analysis and the challenges and implementations in regarding unit are expressed separately. While the unit of analysis narrows in scale, other segments vary depending on it. Interventions to increase bed capacity generally affect the unit configuration. For example, nurse rooms, staff room, or surgery's transformation into patient rooms. Likewise, to meet the need for increased bed and infection control, medical equipment and healthcare staff has been increased, and new spatial barriers has been created to prevent aerosol spread. The congestion, chaos, and confusion has been experienced in nurse desk due to the increase in ICU staff. When focusing on the patient bed space, challenge in isolating the patient, monitoring the patient with a camera or monitor, incorporating new medical equipment into the bed space, and communication problems with the patient come to the fore. The research question investigates the difficulties associated with communication and interaction between the patient and the nurse. The main aim of this study is generating a design guideline of the adaptable patient bed space for future respiratory pandemics. In other words, developing ICU bed space preparedness checklist to assess the ability to future such pandemics. By moving towards the main aim, sub-aims need to be determined in order to obtain accurate data. These sub-aims are understanding spatial challenges and the practices of ICU staff to overcome this challenge and transferring the experiences of ICU staff to this study. A multidisciplinary study design required to achieve these aims. Within the scope of this study, the experiences of ICU doctors are considered in order to understand ICU space as a whole. Additionally, the communication and interaction between the critical patient and the ICU nurse is investigated in relation to the bed space. The case study area is Istanbul Research and Training Hospital, one of the busiest hospitals in Istanbul during the pandemic period. Built in 1960 and renovated in 2005, this hospital has the third-level reanimation ICU with a 22-bed capacity on the ground floor. It is located on the European side of Istanbul and close to Marmara Sea and therefore has sea views in general. This table indicates which data was obtained from which spatial scale. In the first column, the space scale gradually narrows from the general ICU to the patient bed space, which is more focused area. The methods used to collect data are stated at the upper segment in red, and categories these methods match with are stated just below. While general observation is based on the spatial organization and space relations of the ICU, detailed observation specifically focuses on ward-type rooms and patient bed space. Likewise, in ICU doctor interviews, there are questions regarding the whole ICU space. Detailed ICU nurse interviews and ICU nurse questionnaire include detailed questions regarding patient bed space. At this stage, the design criteria are clear, questions are defined and target-oriented. This table provides a classification of the design criteria used when collecting data. In other words, the categories used for the spatial evaluation of ICUs and transferred here from the literature review are expressed in more detail. The main categories are unit configuration, space dividers, and patient bed space. Subcategories for unit configuration include size and capacity, spatial organization, and lighting. Material and size are researched in the main category of space dividers. Visual, auditory, and tactile communication are evaluated under the main category of communication in the patient bed space. Observation record and check table is the methods of obtaining information in all categories. ICU doctor interviews mostly include questions about unit configuration and space dividers, also questions about spatial interventions in the patient bed space. The interview and the questionnaire with the nurses actually consist of the same questions and include the same design criteria, which is the communication between the patient and ICU nurse. In terms of space configuration, this ICU is on the ground floor and has a plan layout with 3 ward-type rooms for 6 people, 2 isolation rooms, and a double patient room transformed from a nurse room with a total of 22 beds. Patients are monitored with a camera from the central nurse station, and also the patient outcomes flow from the central monitor. There is also a nurse desk in the ward-type rooms. At one end of the ICU corridor, there is the main entrance from the inside of the hospital and also a separate entrance for patient relatives. And at the other end, there are supportive spaces for ICU staff and a staff exit directly connected to the courtyard of the hospital. In terms of space dividers and bed space, while folding aluminum panels are used in some ward-type rooms, all patient bed space can be closed with a fabric curtain system. Ward-type room doors made of aluminum joinery and glass are automatic sliding doors. Patients at opposite side of the room can see each other when curtain is open. In detail of the patient bed space, there is enough distance between patients in accordance with the regulation, but not enough space around the bed for patient manipulation or more medical equipment. These are some photographs from ICU, the corridor view and the entrance of ward-type rooms, and ICU ward-type room nurse desk and curtains as space dividers. This table contains a compilation of findings of nurse interviews and the nurse questionnaire together according to designated categories. The table indicates that general communication decreased during the COVID and the effectiveness of nurse station increased. In terms of visual communication, patient monitoring from the nurse station is effective and ward-type rooms have a positive effect in terms of visual observation of patients. The visual communication is reduced when space dividers block the front of patients. Also, patient monitoring digitally has become more effective and the need for one-to-one contact has decreased except emergencies. Space dividers are not obstructive in terms of auditory communication. While ward-type room can be supportive to other patients in situations where patients are positive, they can be worrying for other patients in situations where patients are very critical. While the use of overlapping PPE prevents infection, it limits auditory communication. In terms of tactile communication, ward-type rooms are suitable for frequent tactile contact with the patient and rapid physical intervention to the patient. Patient bed space is sufficient for normal times but is not fully sufficient for urgent physical interventions such as prone position and more medical equipment placement. PPE used for infection control reduces tactile communication. And lastly, ICU nurses' tendency to use digital monitors to avoid infection can sometimes reduce tactile communication. What are the expected contributions? The most important one is the generation of a design guideline of an adaptable patient bed space, allowing more efficient and accessible critical care for future pandemics. And then optimization of workflows of ICU nurse in increased critical care demands. And lastly, to encourage governments, policymakers, hospital managers, and healthcare staff to work with other disciplines in such pandemic situations. I thank you all for listening, and please don't hesitate to contact me with any opinions, criticism, or doubts.